Hello, I'm Bhavni, and today I am interviewing Amit Shah, who is a pharmacist at SMS Chemist in Wembley.
I've been working as a pharmacist for nearly 4 years now. Qualified in about 2012. The reason I got into pharmacy is because of my interest in medicines and how they're made, and also, helping the public. I do feel like a lot of people don't know that there are animal products in medicines, but at the same time, there's very few medicines nowadays which actually do have animal products in them, and even those ones, manufacturers are kind of trying to change across the sources that they're getting the ingredients from to make them suitable for vegetarians, so there shouldn't be too much of an issue most of the time. Well, you're mainly looking at the capsules. So, for example, amoxicillin capsules, certain manufacturers will actually use bovine byproducts to create the gelatin in case it's the actual drug. Mainly it is just only capsules these days, some vaccinations also. However, most people don't take vaccinations on a regular basis, so it shouldn't be too much of an issue. We do get a lot of questions from patients regarding where products from within the medication, whether it's halal or whether it's kosher, vegetarian, vegan sometimes as well. But I think a lot of the people that do have these questions don't ask them because the information might not be so readily available, and they may not know where to go to ask the correct questions or who to ask the questions to.
And then keeping that in mind, when they have found out that it has an animal byproduct, have they ever refused to take the medicine?
We have had quite a few people who do come in, ask questions about where the excipients are from, where the medications come from, and when we do tell them that there are certain animal byproducts in there, some people have refused to take it based on religious views, but on the whole, most people do carry on taking the medication because it is for health purposes. Well, with mainstream medicines, the more common products, such as blood pressure tablets, they don't really contain any animal byproducts. So when it comes to things that you're going to be taking on a day-to-day basis, it's not too much of a concern about where the medications come from or where the ingredients have come from. It's more when people are considering obscure medication. For example, vaccinations like hepatitis B, which are cultured on hen's eggs, they're not considered suitable for vegetarians, but that's based on personal choice, because we do have a lot of vegetarians who come in for vaccinations at our travel clinic, and we do inform them that some of the vaccinations are cultured on hen's eggs, and they're more than happy to carry on because it's, at the end of the day, it's on a religious belief, but it's about where's the benefit and where's the cost.
So talking about eggs, some people actually have allergies to eggs as well. Is there an alternative for vaccinations for people with allergies?
Well, when it comes to an egg allergy, most of the time, people who do get the vaccinations done, even if they do have an egg allergy or an allergy to any of the products, most of the time they're not going to show any sort of reaction. It's on very rare occasions that they do react when they are allergic to eggs. Sometimes when you're looking at why they're using animal products, it's actually because sometimes the ingredients that are actually only found within animals, and it's hard to extract it from a plant. And yeah, there are some sort of commercial benefits in terms of costings, but more so it's because you can't grow bacteria on a plant. You have to grow it on something that's live, which is why they use, more often than not, hen's eggs. Sometimes they even use horses. They may even use, in China, they use Chinese hamster ovaries. So there's loads of different things that they may use, but there's always a reason behind it. It's not just a commercial thing. I think that nowadays you'll find that a lot of products which are suitable for vegetarians do come marked with the V sign, which you can find on food products as well. They are trying to improve the way that they label and market their products, and more often than not you should be able to get the information quite easily whether what you're taking is vegetarian or if it's not vegetarian. To be honest, the National Pharmacy Association aren't really involved in any of those sorts of issues. However, the MHRA are starting to take a bit more of a forward stance on trying to make medicines more accessible to vegetarians. And I feel like there has been quite a big step forward in terms of medicines that have previously been using animal byproducts. For example, there's diabetic medication, which used to contain animal byproducts. Now they've changed to plant extracts instead, so making it a bit more accessible to everyone. My advice would be speak to your pharmacist, because they've got access to a lot of resources which do provide all the information that you would need to know whether the medication is, as I said earlier, halal, kosher, vegetarian, vegan, and also where the excipients are coming from. So there's a lot of books that can be found within a pharmacy, and the pharmacist also is given that sort of knowledge and access to that knowledge that they should be able to provide any sort of information to all the questions that need to be asked. All medicines over the counter are suitable for vegetarians. There's not really anything that stands out which might not be suitable, but if there are any sort of queries or any questions regarding it, within the patient leaflet there is actually information which does give the source of the ingredients, so it does help when it comes to all the questions that are being asked.
Thank you very much, Amit. Really appreciate your time and on this really important issue for the magazine and for our listeners.
That's my pleasure.